Well, thank you very much indeed. I was born and brought up and educated a few miles away from here, so it's a pleasure to be back in Wales. It's also a pleasure to serve as a Bevan Commissioner. I'm grateful to Chris, Laura, Helen and colleagues for asking me to take on that role. I was reflecting that on previous anniversaries of the NHS, we might have come here to debate the organisation and structure of the service, or indeed its financing and efficiency. But I think today, in my view, our concern is much deeper. Our concern is the heart and soul of the NHS, because I would take the view that we're experiencing a crisis in health and in social care, which hasn't had much discussion so far, the like of which I've not seen in the nearly 50 years that I've now been working with and for the NHS. And picking up what the First Minister said, I don't think that crisis reflects failings within the NHS. I wrote this report published by King's Fund in April this year, and the subtitle gives away the message of the report. The problems we have and the real crisis in health and social care has been caused by failures of Westminster politicians and their failures in exercising their stewardship of the NHS and doing so effectively and properly. Because after the huge improvements through investment and reform we saw in the first decade of this century, we've seen steady decline since 2010 for a whole bunch of reasons which I'm not going to go into now, which will be familiar to all of us in the room. And that's put us in a position where we do need to embrace the kind of thinking we've heard about this morning. I will quote Nye Bevan, a different quote, the, I suppose, philosophy, the purpose that he had in mind when he said, "Illness is neither an indulgence for which people have to pay, nor an offence for which they should be penalised, but a misfortune, the cost of which should be shared by the community." Now, I want to come back to some of those words in the short time I have today, because I think what in essence he was saying is it's based on mutuality. We're all in this together. We all contribute towards the funding of the NHS, and we all benefit when we need to access care without the fear of how we will pay for that care. And mutuality remains at the heart of the NHS, in my view, and we need to see what we can do to strengthen it and adapt it in other and different ways. I have the privilege today of co-chairing a body called the NHS Assembly. Nigel was asking me, what is the NHS Assembly? If Nigel doesn't know, I perhaps should spend just a few seconds explaining. It was set up 4 or 5 years ago by Simon Stevens when he was the Chief Executive of the NHS in England. It's a broadly based group of stakeholders, 50 people, coming from patient backgrounds, carer backgrounds, staffing backgrounds, people you will know and heard of, heads of the medical royal colleges and the national professional bodies, but also lots of people you will never have heard of, because that's the purpose. It's to bring together a group like this to advise the leadership of the NHS in England on its future direction. And Amanda Pritchard, Chief Executive of the NHS in England, asked the Assembly to prepare a report which was published 2 weeks ago. And you can access this by Googling it and finding it on the website. A report setting out views on what needs to be done to strengthen the NHS. This is in England, but you will make up your minds whether it applies equally well to the context in Wales, as we celebrate, quite rightly, 75 years, and we think about where next. I don't have time to do justice to this report. I will pull out, though, some of the background and then go on to the key priorities. There are 3 priorities set out in it. What's important here, it wasn't just 50 people sitting in rooms and having great thoughts. There was genuine engagement of staff. Their views were actively sought, of NHS leaders running hospitals and community and mental health and other services. Patients and carers were involved as well, plus businesses and others with an interest in the health and well-being of the NHS. And the feedback and the views that came through from that consultation and engagement process really lie at the heart of what's in this report. It really was about accessing the wisdom of the crowd, if you want to use that language, and building on that in the recommendations that were put forward. And I know Helen and colleagues in the Bevan Commission will be shortly doing something related in Wales. The Minister has shown interest in this here, and there may be some lessons to draw from what worked and also what didn't work so well in the English context. But the engagement and the views of the Assembly focus on these three shifts, and they've all been mentioned in different ways already this morning, which I think is a good thing because it means we're all converging around similar issues. The first is, and this is not new, I mean, when I started my career working with the NHS in the mid-1970s, there was a document published by the government of the day called Prevention and Health, Everybody's Business. Well, plus ça change. This is about really taking prevention much more seriously. Of course, the NHS has a major role to play, but the NHS can only do so much. The work of Michael Marmot and going back further, Douglas Black and then Donald Aitchison and others, particularly focusing on those wider and social determinants of health and well-being, which is so important when it comes to explaining and then doing something about disparities or inequalities in health outcomes in our population, which remain as persistent as ever. And this cannot be done, therefore, just within the NHS. It's about working with businesses, with communities, with partners of many different kinds. I know when I was working in the NHS in the Midlands, educational institutions, for example, were very important, schools, colleges, and universities. And boldly advocating through the NHS for government to play a much more active role. You know, the tools of taxation, of regulation, of legislation are underutilized at the moment. There have been precious few in the last 10, 12 years compared with previously. And government needs to be more willing to use those tools if we're going to see the benefits coming through on creating health or preventing ill health. As you can see, the second shift then is about personalization and participation, recognizing, as the Minister said earlier on, the positive role that every citizen plays in improving health and well-being and using our services wisely and appropriately, being real partners themselves with clinicians and professionals in promoting independence and doing everything possible to remain in good health and to support others in that. Having that continuity of relationship and making sure that when there's an assessment of how well the NHS is doing, the views of patients and carers and others and their voices are very much to the fore. And then thirdly, the shift from hospital-centred care to coordinated care closer to home. General practice remains the foundation stone of the NHS, and as a BMJ editorial said a few years ago, if general practice fails, the whole edifice of the NHS will be undermined, and I believe that to be the case. And the challenges and the pressures in general practice are growing almost day by day. So we need to accelerate plans that have been very much talked about to strengthen and put more investment into general practice, but also the associated community nursing services and the wider contribution from mental health, social care, and others beyond. We need to have excellent, urgent community response in every neighbourhood, in every community, to help people remain at home wherever that's appropriate and the right thing to do, and to support people to remain independent for as long as possible, so that we use our hospitals for what they're intended as. The treatment of acute illness using specialized teams, bringing all of their expertise to bear. And most of our hospitals today are not able to do that because they're caring for people and patients who could be better cared for in other settings. So the elements of this already exist. Hospital at home, virtual wards, these integrated neighborhood teams aligned with general practices, doing innovative work in many parts of the United Kingdom. We need more of it, and we need the funding to flow in that direction. When I produced my report for the King's Fund back in April, I looked back at where has the extra money gone in recent years. And disproportionately in England, it's gone into hospitals. And by comparison, general practice and community services, their share of the total has actually fallen as a consequence. We can't keep on doing that. We need to be bolder in actually implementing the plans and the ambitions that have been talked about. If we're going to do that, here are some of the enablers which need to underpin these changes. It's not good enough to say what needs to be done. We also need a theory of improvement and a practice of change to get us from where we are to where we need to be. I'm not going to talk about all of these because time is against me, but there are 7 enablers here, and you can see for yourself what they are. I don't think many of them will be a surprise, if any. I do want to speak about the 2 at the bottom. The first is about leadership and learning. We need, in my view, much stronger focus on how the NHS can really become a learning organisation, a learning system, committed to continuous improvement. And what that must mean is that we trust staff, we support staff, we train them in tried and tested quality improvement methods and give them the time and the space to apply those methods to bring about real change for patients and those they're serving. We need to involve people with lived experience in that work and people who have living experience of services to get real-time feedback to improve the pathways which are used to support people to access the best possible care. I've been doing some work on this recently, and I was in discussion with Healthcare Improvement Scotland, which has been working now for over 10 years to do this north of the border. Derek Feely will be speaking later. I know, Derek, you've had an involvement with Healthcare Improvement Scotland, other colleagues too. It's a working example of what kind of capacity and capability we need to make a reality of what I've been discussing, learning and continuous improvement. And then on the other side at the bottom, there's this focus on people and communities as active participants in improving health and using services. This idea alluded to already of the need for a compact, being explicit about what the public have a right to expect of the NHS, and in turn, how the public, people and communities can contribute to the sustainability and the improvement of the NHS. And that's what the NHS Assembly would like to see, being much more, as I say, explicit and upfront about what that involves, recognising responsibilities as well as rights. So those are the core ideas in the NHS Assembly's document for Amanda Pritchard, celebrating the 75th anniversary. And I would say the key issue here, coming back to mutuality, is about how do we recognise and build on our shared responsibility for health and care. By shared, I mean shared between government needing to be much more willing to use the tools at its disposal to create the conditions in which people could thrive and live healthy lives. The NHS taking prevention seriously, it is everybody's responsibility. The wider partners in local government and business and education and beyond, and then each of us as citizens. I had the privilege earlier this year to visit the Frome medical practice in North Somerset. I spent the day there with the GPs and the clinical teams, understanding what they've been doing. It's a great example of many of these issues, and particularly looking beyond traditional medical care to the wider contribution of people and communities themselves. In Frome, they serve a population of 30,000 people. They make use of 1,000 volunteers in that community, people they call community connectors. They might be taxi drivers, they might be postmen, and women. They have a variety of different roles, and their job is to signpost the sources of support and advice available to local people when they need to access that support. Within the practice, they have paid health and social care connectors, and these are the teams or members of the teams who aren't professionally trained, but their role is to have a particular responsibility for patients who are high risk, and then to connect those patients when they have a need to relevant clinicians and social care professionals. They make use of all of the assets, and they've been able to reduce unplanned hospital admissions, hospital bed day use by the people who live in Frome as a result of this holistic model of community-oriented primary care. There are similarities with the Wigan deal up in the northwest of England, which is another version of the compact. It's about that mutuality that Bevan spoke about, which I believe is still at the heart of the NHS, but we need to revisit and refresh as we celebrate the 75 years. The work of Nobel Prize winner Elinor Ostrom, who wrote about the tragedy of the commons, reads directly into this. I mean, her basic thesis is if we have common resources and we want to avoid overusing them, we all have to play our part in taking responsibility for how that is done. We can't rely on others to do it for us, which is why I particularly want to emphasize that shared responsibility for not just sustaining the NHS, for improving it as well. I believe, for example, that the Future Generations Act in Wales is one practical example of what this means. So I am optimistic about the future. I think if we can build on these ideas and what you heard from Nigel and from the First Minister, we have every prospect of being able to sustain and improve. And I'm afraid I'm going to reiterate what's been said already, another Nye Bevan quote, that the NHS will last as long as there's folk with faith left to fight for it. I think the question for all of us, are we part of that folk willing to fight for the NHS? I think the first battle, the first fight that Mark Drakeford spoke about this morning, are we up for it? And if so, can we find the courage to do so? Thank you very much.